Welcome back, everyone. This is your first time here. My name is Dr. Stefan Wilson, and the purpose of this channel is to analyze the mechanisms of sports injuries. So if that's the type of content that interests you, then please consider liking and subscribing to this channel. Today we're going to analyze the injury to Texans receiver Stefon Diggs and his right knee. So we'll jump straight to the video here. So what's going on here is the Texans receiver Stefon Diggs. He's coming off the line of scrimmage. He's running down the field. He's going to stop and cut back, but what we're going to be looking at is his right leg here. That's the leg in his knee that was injured on the play. So when he plants here, he wants to plant with his right leg so he can cut into the middle of the field. So pay attention. We want to look at his right leg. So when he plants, there's his right foot. His right foot is flat on the ground with his toes pointing relatively straight forward down the field, but we can see the positioning of Stefon Diggs's, the trunk of his body here. So his trunk is turned slightly away from his right foot. So his right foot plants. Now we'll look at his knee. His knee is slightly bent. It's in a slightly flexed position, but as his right knee bends, it's going to drop slightly to the inside. Now remember, his toes are pointed straight ahead, but his right knee is going to flex and bend to the inside. And here we can see ever so slightly his right tibia, his shin bone right here, is starting to move forward relative to his femur. Now what prevents that from happening is a ligament in the inside of your knee called your ACL, your anterior cruciate ligament. So with the planting, the flexing of his knee, and then dropping inwards in a valgus type motion, meaning from the outside pushing inwards on the outside of his knee, turning inwards, we can see his tibia right there, his shin bone moving forward relative to his femur. That motion right there, that motion is going to place a lot of stress on his anterior cruciate ligament, putting him at a high risk for an ACL tear. It was confirmed 2 days later. Stefon Diggs did indeed, in fact, suffer a right ACL tear. Stefon Diggs is done for the season. We'll correlate this movement and this injury with the anatomy screen so we can fully appreciate exactly the structure in his right knee that we're talking about. So as we look at the anatomy screen, we want to take a look at the right leg here. So of course we have the thigh bone, the femur on top with the kneecap, the patella here in the front of the knee, and the long shin bone, the tibia, and the fibula right beside. The role of the ACL is to provide stability for the knee and to prevent the tibia from moving anteriorly on the femur. ACL is inside your knee, situated right about there. Stefon Diggs did tear his right ACL and will be done for the season. He will require surgery. As always, I really appreciate your time today. Thank you for watching.